Welcome everyone to the Concussion Legacy Foundation webinar, How Physical Therapy Can Help Treat Post-Concussion Syndrome. I'm Tyler Maland, Chief Impact Officer at CLF, and this is part one in our four-part summer concussion webinar series, where we will highlight different treatment options for those struggling with persistent concussion symptoms. Today we're focusing on physical therapy, and we'll discuss which symptoms it can treat and how it can progress your recovery. It's important to note every concussion is different, and what works for one person might not work for another. That is, of course, as I'm sure many of you can relate to, one of the more difficult parts of this injury. With many treatments, including PT, a degree of trial and error is involved, so please don't be discouraged if you haven't found the right fit for you yet. Today, we are very excited to have Dr. Lindsay Walston, the Neurologic Residency Director and National Education Coordinator at PT Solutions Physical Therapy, here to touch on that further and share with us her expertise. We'll end the webinar with a Q&A session with Dr. Walston, so if you have any questions for her, please submit them to the Q&A box at the bottom of the screen. Today, you'll also hear from Noah Bond. Noah has suffered from post-concussion syndrome for nearly 4 years. He will share his experience with physical therapy and how it helped dramatically improve his symptoms. Before we get to our guests, we want to make sure you know about a few of the new ways we're supporting the concussion and PCS community. We know how hard it can be to find the appropriate care team for concussion rehab. Without guidance from a trained concussion specialist, it might be difficult to know which treatments, like PT, you should seek out and when. If you're looking for help choosing the right doctor for yourself or for a loved one, our CLF helpline staff is here for you. Our helpline has a fantastic mentorship program, so if you're interested in connecting with someone who has lived with PCS, either as a patient or as a caretaker, please reach out to us. You can submit a request at concussionfoundation.org/helpline, which you see on your screen there. We're also building a growing community on Facebook through our brand new PCS resources group. We'd love to have you join with us and connect with others experiencing long-term concussion symptoms. You'll see a link to that group in the chat right now, and it's also up on your screen. And finally, we also have a new series on Instagram filled with tips, strategies, and stories of recovery from CLF Communications Manager Julia Manning, who's been suffering from PCS for 3 years. She's already covered topics like coping with loss, sleep issues, noise and light sensitivity. Please make sure to follow us on Instagram at Concussion Foundation to catch new episodes of PCS Recovery Corner with Julia. And we're also posting a lot of PCS content about folks who are coping and finding hope and telling their stories. So make sure to give us a follow at Concussion Foundation on Instagram. And finally, a quick note to let you know, we are recording this webinar as we always do. So if you need to take a step away, take a break, give it a pause, or if you're not able to catch all of the information, we will plan to email it out to all of you afterwards, and we'll also post it to our YouTube channel, which you can subscribe to at the link in the chat. All right, we are going to get started here with our first guest. And I'm going to pull him in. Welcome, Noah. So our first guest is Noah Bond, who's joining us from his home in Hull, Georgia. Noah suffered a concussion at football practice on what first looked like a normal play. It turned out to cause not only a concussion, but years of post-concussion syndrome. I first met Noah when he visited our office in CLF in early 2017, which was one of his many trips to Boston to receive treatment for his PCS. But I really got to know Noah when I traveled to Georgia to meet him and his family later that year. Alongside Esther Lovett, Noah was the recipient of our 2017 Resilience Award for his courage in fighting PCS, and I arranged a video crew and flew down to help Noah and his family share his story. And that's the video you see on the screen now. So sharing his story was just one example, and there are now many more of how Noah has used his experience to become an advocate for other kids struggling with concussions and PCS. He's been involved with us at CLF ever since those first meetings in 2017. He's an awesome ambassador for us. And Noah also just graduated from high school and plans to go to Liberty University in the fall, where he will join the golf team. So Noah, welcome. Congratulations on your graduation, and thank you so much for being here.
Thank you so much for having me. I'm so excited to join and be able to talk for a little while.
Yeah, a lot of folks who follow us on social probably know your face already, and I'm excited for other people to hear your story. So today, obviously, we're focusing more on physical therapy as part of treatment. At what point after your injury did you first start physical therapy, and what was your experience with it like at the beginning?
So I started physical therapy just about 8 months after my initial big concussion, right before seeing Dr. Ken 2 and going into the study. I met Dr. Ken 2, and he ended up setting me up with a targeted plan for my specific physical concussion symptoms. And I think the biggest symptoms that we were dealing with at the time were balance issues, dizziness, low energy, neck pain, and of course, headaches.
So that's a lot of symptoms. Were there some of those symptoms that you felt the PT really helped to treat?
I think the biggest symptoms that post-concussion syndrome needed physical therapy to kind of push over the edge was my balance problems, my neck pain, dizziness was a big one, and my headaches initially got better as well.
That's awesome. What have you learned about, if people watch your video, they can understand, Noah, this has been a long road for you. This did not get better immediately. In fact, you're still feeling some symptoms, I think. What have you learned about the importance of really seeking out treatments when you're suffering from PCS?
I think it's very important to seek out help, to find some treatments of any kind. Each thing works different for other people, which is a very big factor in post-concussion syndrome. But I think it's very important to seek out help for treatment because that's one of the best ways to get better.
Yeah, I think I remember you mentioning you really developed a relationship with your PT at Emerson. How did that help you kind of progress along in your recovery?
That helped. That was probably a very big factor. Josh was his name. He's beyond helpful, beyond my physical therapist. He ended up becoming one of my great friends, which I don't know if you know this, but we actually tried to get him a ticket to go to the gala when I got the award because I felt like he deserved that place of honor to come.
That's awesome. So I guess sort of the message is, treatments might not work right away, but you got to keep trying different treatments and seeing what actually starts to help the symptoms. It sounds like you kind of locked in on some physical therapy treatments that really started to help your recovery. Is that right?
Yes, sir. Right when we started, we could kind of see which ones were working and which one was helping. And once we stuck to it, after a while, you could definitely see improvement.
That's awesome. How are you doing today now? How are you feeling?
Today I'm feeling good. I've definitely had a lot more good days than I used to have. As I still deal with a lot of symptoms just on a daily basis, we do have a lot more good days than we used to, which is definitely improvement.
Yeah. Are you still doing PT?
I try to go whenever I can, but not as consistently as I should.
Yeah, it's also, as we know, our current times with COVID-19 make, visiting clinical specialists a little more difficult. I think we'll hear a little bit from Dr. Walston later today on how that's been for her as a treatment specialist during this strange time and how people can still kind of try and find those right treatments. So we'll ask her about that. I know it's been a strange spring for you, Noah, but you're about to graduate and you've come a long way from your injury. I guess one more question for you would be, what would be your message to other folks who might be going through this? How do you recommend people find hope and really work towards recovery?
You have to be consistent and you have to know that you're not alone through the process. So many people are going through the same thing. And to know that somebody's there who's going to go through the same thing as you and also that have more knowledge about the situation that can help is such a big comforting factor that I think applies to everybody.
That's awesome. Thank you. And if people haven't seen it on our social media feeds, Noah actually shot a hope video for our Concussion Hope series that was really well received. And I know a lot of people commented that they were inspired by it. So Just want to say, Noah, thank you for continuing to be an inspiration to other people with PCS, and we appreciate you coming on.
Thank you so much for having me, Tyler.
Awesome. All right, I'm going to switch over here. So excuse me while I hit some controls. I'm going to pull up our next guest. All right, thanks again to Noah for joining us. I mentioned this, but Noah's in some great videos that are on our social media feeds and on our website. So make sure to go to concussionfoundation.org and all of our PCS pages to see more from Noah. You can also hear more from Noah and his parents, Lisa and Wes Bond, in our This is PCS series. And they have some videos focused on family support for concussions, returning to learn after PCS. So we are so thankful for Noah for being such an advocate and for his parents for really helping talk through other parents what it's been like to help Noah out with his PCS and get him on the right track of recovery. So thanks again to Noah for joining us. And now I want to announce our next guest, Dr. Lindsay Walston. So Dr. Walston is joining us also from Georgia, this time from the Atlanta area. And she is coming to us from PT Solutions Physical Therapy. She specializes in neurological physical therapy and has years of experience treating concussion patients. And today she's going to share how PT can be used to treat PCS. So hello, Dr. Walston. Thank you for being here. I'm really going to let you run the show. I'm going to turn things over to you. I just want to let people know if you have questions for Dr. Walston, please use the Q&A box at the bottom of your screen, and we'll get to as many questions as we can after her presentation. So with that, I'm going to unmute you, and the floor is yours, Dr. Walston. Let me share. You should be unmuted. Hold on. There you go.
I'm going to share my screen so you can see. So we'll go through a little bit of a presentation. So just to give you an idea of my background, so I currently run a Neurologic residency program for PT Solutions. My background prior to that was in traumatic brain injury. Actually did a neurologic residency at Emory and spent a good bit of time working with people with more moderate to severe traumatic brain injury, and a lot of time working in their vestibular specialty clinic there. And that's kind of how I got into the concussion world. Ended up shifting to outpatient, which is where I am now. And so this is a field that I've essentially specialized in over time. It's something that I work with regularly. And I tend to see people that are pretty far post several years, typically, if not more, some more complex cases. So happy to answer any questions that you might have. But from the purposes of this presentation, we're going to kind of keep it high level. I'm going to talk about some things that I see most people with prolonged or persistent symptoms complaining of and how physical therapy can address it. And if you have specific questions or individualized questions, I'm happy to answer those. I'll give you my email at the end of the presentation too, so you're more than welcome to follow up if you have any additional questions. Because the innate challenge with this, right, is, as we've already alluded to, is the variability in symptom presentation. No two concussions look alike, which makes it really challenging to manage sometimes. And so it's not a one-size-fits-all kind of treatment progression. It is highly individualized, and that's where the value of physical therapy can come in handy. So just from a general overview perspective, in the last 10 to 15 years, we've seen a transition away from the rest is best mentality. So that whole dark room till you're asymptomatic, and then you can come out and resume normal activity. We're seeing that doesn't result in the best outcomes. And what is generally best, particularly with an acute concussion, is some level of rest, maybe 24 to 48 hours. And after that, it's an accent active symptom-based return to activity. So depending on how severe your symptoms are, depends on how quickly we progress. So there is still, unfortunately, a lot of misconceptions and misinformation out there. Some of you probably heard a little bit of everything. And so it's really important that we work through those and you have the resources that you need to get yourself, or to help work through and get yourself better and back to what you were doing prior to your concussion. So we'll talk about some of those misconceptions as well as we move through this presentation. But the whole premise of physical therapy is essentially that exercise is medicine. And this is not specific to concussion rehabilitation. This is exercise in general can do a lot of things to help promote recovery. So from things as technical as promotion of neuroplasticity, we can get real technical there, but essentially it creates an environment that is conducive to nerve healing and nerve growth and nerve regeneration, which is exactly what you need in concussion. It helps to reduce inflammation, particularly and neurologic inflammation, which can again help speed up the process of recovery, and can also improve cerebral blood flow, which is really critical for addressing your symptoms, for cognitive function, for return to normal life. And so on the other side of that, we also see the negative impacts of rest and what a big factor that can also be. So the cocoon therapy, what we see is that can sometimes result in more persistent or prolonged symptoms, which everyone's goal is to get back as fast and as quickly as possible. And so that's where we have the shift to a more active symptom-based recovery and transition. There's actually limited evidence for complete and total cognitive rest beyond about 24 to 48 hours after concussion. And then we also see, especially if you've been inactive for a really long time, the impact of physical deconditioning that's even separate from the concussion itself. So in technical terms, it impacts autonomic control, but that can look like intolerance with exercise, cognitive impairments, difficulty with sleep, difficulty regulating vital signs. So that can manifest in a lot of different ways that can contribute to those persistent symptoms that you may be experiencing. So when looking at how physical therapy can be valuable, the first and most important premise is that one size does not fit all, right? If you've had more than one concussion in your life, you know the odds are that the two or more looked very different. So person to person, same deal. It's not a blanket exercise program for concussion. It is highly tailored and highly specific to exactly what kind of things that you're dealing with as an individual. So to be able to tease that information out, that's where that a targeted evaluation comes in. And that's essentially figuring out where your symptoms are coming from, what is driving what you're experiencing. Because if we can figure that out, we can identify and address it very precisely. So from an evaluation perspective, you might see something, especially if you've already been in therapy, a cervical assessment, which is looking at your neck, looking at range of motion, potentially looking at provocation of headaches, strength, a couple different things there. And then looking at some level of vestibular ocular assessment. There's a lot of different ones out there. Some of you might be familiar with something called VOMS. And it looks at level of symptom provocation with ocular movements, so things like visual tracking, convergence, and then also symptoms produced with gaze stability, so being able to focus on a target with your head moving. Finally, a really common measure to assess exercise intolerance is exertional testing. So putting you on a treadmill or a bike and looking at if we can provoke symptoms at specific heart rate ranges, because again, that gives us more ammo, more information about how to specifically address the symptoms that you're experiencing with your concussion. So from that individualized evaluation, essentially what we do from there is create a highly customized plan and prescription of exercise. So this is going to vary widely. So again, just like the evaluation, no two concussions are the same. It depends on a couple of different things. So what your goal is, if it's eventually return to sport, if it is return to school, return to work, whatever that looks like, your session and your plan and your exercises should be geared towards that. And also looking at the phase of rehabilitation that you're in. If your symptoms are really elevated, we want to spend some time reducing those so that you can move and you can be active and you can do things that are in your community or related to your goals. Because if you're already sitting at an 8 or a 10 out of 10 symptoms, you're at rest, you're not going to be able to tolerate very much from an active intervention perspective. So bringing those symptoms down so that we can start to work you through some of the issues that we saw in the evaluation. Then two, looking at dosing of exercise. So maybe you picked up, you read that aerobic exercise program or some kind of exercise program was beneficial, but maybe it didn't go well. Maybe you can't get past a specific point in your recovery, you just feel kind of stuck. And you're not really sure where to go next. That's where physical therapy can be really valuable, because we can help you figure out how much is that right dosage and how often should it be done. A lot of these exercises are great, but they should be performed at a specific repetition, duration, and intensity to maximize the benefit that you might see. You've all probably experienced, if you overdo it, you might pay for whatever it is that if you were doing a lot of computer work or maybe exercised at a higher level than you were before and you experience symptoms, elevated symptoms for several days afterwards, that's a lot for your system. The idea is that we challenge you, but not to the point where you feel like you're laid up for a couple days after. The other piece that is really crucial for successful physical therapy is consistent and frequent reassessment. So again, you guys know, I don't have to tell you, every day is different. And so being able to meet you where you are in that particular day is going to be crucial to your recovery. And then reassessing and knowing when we can progress and push a little bit more so that we're also very efficient with your time. All right, so I'm going to go through 3 different types of interventions or exercise that you might have already seen if you've had experience with physical therapy, but I also want to kind of tell you the why behind it and kind of target some symptoms that I see most common in people that have had symptoms for a really long time, and how we can help address them. So first is aerobic exercise. This is huge. So this is can be used to address a lot of symptoms, but it can also be used to promote healing and recovery for a lot of other things too. So specifically looking at incorporating exercise, helpful in things where like exercise intolerance, maybe you can't work past a certain threshold, you get a headache if you exert yourself, or maybe you have a really non-specific headache, potentially some level of fatigue, difficulty sleeping, concentrating, or maybe you notice that your heart rate and blood pressure are elevated a bit. These are some signs that this type of intervention might be really helpful for you. And what we see in the research is actually that the earlier you can start this, the better the outcomes. So for this specific study that was done in 2018, it showed that earlier time to aerobic exercise associated with fuller and faster return to sport and school following acute concussion. So again, it's all relative, because if you look at how much exercise they were getting, it was initially a walking program and then progressing from there. But getting moving in some capacity and whatever you're able can be really valuable to help promote recovery. From a specific graded exercise prescription perspective, we can look at exactly where that threshold is for you. And that's really crucial, because then we work just below that and gradually progress you into that range. It gives you specific parameters for exercise. So if you're active and doing things outside of therapy, you know kind of where you want to live from a heart rate range perspective, which can be helpful. And then it also gives us a really great way to reassess. So if before you couldn't get past a heart rate of about 120, and then next time we reassess, it's 135 or 140, that's correlated to recovery. And we know that you're responding well and we can keep progressing accordingly. Second, and probably one of the things that physical therapy is most known for concussion is in vestibular rehab. So valuable for symptoms like dizziness, vertigo, nausea, motion sensitivity, lightheadedness, imbalance or instability, like eye strain or those like really frontal headaches that you might get after reading or having to focus on something for a really long period of time. This type of intervention can be really helpful for you to help move past some of those symptoms. And from a research perspective, what we see is that people that are exposed to and undergo vestibular rehab are 4 times more likely to be medically cleared for a return to sport in 8 weeks. Obviously, that might be past where a lot of you are in the recovery process, but it can be really valuable to address those symptoms to allow you to get back to sport, to work, especially if you spend a lot of time on a computer. That can be really rough if you suffer from some of these symptoms, but that's what they're geared towards addressing. And we know from an outcome perspective, so doing these exercises regularly typically results in reduced reported dizziness, improved balance, and faster return to activity, which is crucial. And the overall intent and the why behind the exercise is to cause adaptation of the system. So these are not fun exercises if you've done them before. The goal is to provoke your symptoms a little bit, but in a controlled manner so that your brain and your body learns to adapt and that it's no longer stimulating at that level for you. Last one, and probably one of the ones that I see the most and hear the most complaints of is that persistent cognitive impairment. And that can look really different person to person. Could look like fogginess, delayed reaction time, feeling slowed down, difficulty remembering or processing information. Maybe you feel like you're not problem solving or working at the same capacity you were working at before. Really common, especially with more chronic or persistent symptoms. So first thing, looking at what other symptoms that you have, because what we know is that chronic pain and chronic dizziness results in significantly worse performance on a lot of cognitive measures like assessing long-term memory, selective attention processing, and executive functioning. So that's like planning and that type of thing. So if you have a high level of symptoms, if you're dizzy, if you have a headache, it's really hard to focus on new information if you can't process it because you're always a little bit distracted. It can be consuming, pain can be consuming and distracting, and that can make it more difficult to perform the cognitive tasks that you might have been able to do with no problem at all prior to your concussion. Can also, so pain and dizziness and a lot of the concussion symptoms you might be experiencing can also interfere with your sleep, which is really also one of the crucial pieces for cognitive function. So looking at sleep patterns, improving those, looking at nutrition, all of these things are ways to indirectly impact cognition. From a direct perspective, there are a lot of resources out there that can help you work on your cognitive function, particularly higher level cognitive tasks. So incorporating those within therapy, starting to layer tasks within your exercise, because again, if you're an athlete, you're not just, or just anyone in general, you're not focused on doing one thing, and that's when people tend to struggle the most, when you're starting to layer tasks on top of each other. So you're having to read one thing and listen to somebody talk, and then trying to incorporate all those things at once gets difficult, particularly if you're dealing with other things as well. So again, something that can be addressed with physical therapy and something that generally improves really significantly, we can address the other symptoms that you're experiencing. Obviously very, very quick and dirty, like it's very general, but I wanted to make sure that we left some time for specific questions. If there was anything in particular you wanted to talk about and more specifics, happy to do that. We have a little bit of time to do that now. If y'all have anything in particular. Otherwise, my email, like I said, my email is at the bottom of the screen. If you have any questions, if you want to talk specifically about your individual situation or need suggestions, I'm happy to help in any way that I can.
Wonderful. Thank you so much, Dr. Walston. That was fantastic. We do already have some really good questions coming in, so I'll keep an eye on those and I'll feed you a couple here as we go. So one question from Mary, and I think this is a good one to start with. How soon after a concussion should initial PT evaluation take place? When should somebody look into PT after their initial injury?
So generally, most of the research supports complete cognitive rest between 24 to 48 hours. So again, it's highly specific to the symptoms that you're dealing with. So if you are seeking therapy within that time, that's not to say you can't do it, but we might limit the level of assessment. We're not going to do a lot of provoking tests. Most of the intervention and assessment is going to be geared towards reducing your symptoms. So there's been a lot of research that's come out lately that looks at more acute management of concussion. So that a lot of the vestibular exercises and even the aerobic testing is safe 7 to 10 or less, even less than 7 to 10 days post-concussion. But again, the intention and the goal shifts a little bit. If it's a little bit newer and potentially a little bit more irritated, what it looks like, what the evaluation looks like might be a little different.
Got it. Okay. Question from Karen. Do you advise cervical injections prior to PT?
So, case-by-case basis, I traditionally don't. If it's something that maybe for my crew that's a little bit, that's been going, maybe has gone through therapy a couple times, not been successful, then that might be something that's recommended to kind of break through. If you're having a lot of neck pain, if you feel very limited, that can be something that can help break through that pain cycle and get you past some of those symptoms to help. But it's not something that I'll generally recommend like on a blanket basis, but it can be helpful in certain circumstances.
Great. A question from Sarah. Would physical therapy possibly be helpful for dysautonomia?
So yeah, so a lot of the exercise program is geared towards autonomic regulation. So especially steady state aerobic exercise can be helpful at kind of stabilizing your autonomic system and essentially conditioning it. Again, from a blanket statement perspective, generally yes. Obviously very situation dependent, but can be, so we know that regular steady state aerobic exercise can help kind of stabilize that system and reduce symptom provocation. So yes, but with context, I guess, would be.
Great. As always, consult your doctor.
Oh yeah, blanket recommendation, yes.
Yeah. We've got quite a few more here. Thanks everyone for these questions. From Nihil, do you suggest supplementing PT with speech therapy? PT has helped my symptoms, but I'm still struggling to multitask and concentrate.
Yes, so speech can be really helpful from a cognitive perspective, especially if that's where you're really struggling. And especially if your speech therapist and your physical therapist can collaborate, because that can give us some resources. Because the end goal is to be able to incorporate what you do in speech or what you do in therapy. So that gives you an additional resource, an additional clinician to help you work through, particularly if there's pretty significant cognitive concerns or issues that yes, absolutely.
Great. From Matthew, are you saying that there is actual neurogenesis in rehabilitation?
Debatable. So neurogenesis, particularly as you get past certain age ranges and developmental perspectives, it's generally isolated to certain regions in the brain. Neuroplasticity doesn't have to be neurogenesis. It can be essentially shifting of pathways and like shifting of efficiencies of the system. So neuroplasticity isn't necessarily just formation of new pathways. It's also conditioning and alterations of current patterns and pathways as well.
Okay.
So there is some research for neurogenesis in specific pieces of or parts of the brain, but the majority of it is more experience-dependent neuroplasticity, which is just an alteration of pathways, essentially.
Okay. Specific one here, and I'm glad you're here because I don't know the details of this one. What are your thoughts on vagus nerve stimulation through using TENS devices?
So I've not done a lot of that, to be honest. I've had people swear by it, and I've had people see very little improvement from it. So I've seen kind of the gambit of responses for it. I don't necessarily know that I have a really strong opinion one way or the other, because that's not something I have a ton of experience in.
Cool. Okay. Couple more here. If I start PT 16 weeks post-concussion, is it too late to start PT? Will it be harder for me to recover by starting so late in the game?
So I've seen people that have never had therapy years and years after the concussion. They didn't really even know what they were dealing with was a concussion. So again, a lot of therapy is just meeting you where you are, and it's highly targeted to whatever you are experiencing. So obviously, in a perfect world, it would be great to start it like at the beginning phases of the concussion, but just because you're starting a little later doesn't mean that it's going to be, you're not going to experience really great outcomes, and you're not going to have a good response.
Yeah, and I think kind of like we discussed with Noah, you know, it might take some time to find a treatment that's really working for you, right? And hopefully PT is one of those, but I know a lot of folks try a lot of different treatments, and some really don't work for a while, and then something clicks and it really works. So
yeah,
don't give up.
It does take time. Everyone's really different, so it does take time sometimes. And so knowing that what you're doing is best and sticking with it for a little while, and then also reassessing, because again, some things work really well for certain people and not others. And you don't really know that if you're not consistently reassessing and checking in on your progress. So that's really crucial to make sure what you're doing is best for you.
Yeah, that's great advice. One from Mark, and hello, Mark Lindsay, who is a brain pledge and a great supporter of CLF. He had a question. Once eye convergence scores are below 6 centimeters, do you recommend continued convergence and vestibular therapy?
Technically, that's within normal range. So a lot of it depends. Again, some of it stems back to symptom provocation. So if it's normal and it's still highly symptom provoking, then that might be something we continue to work towards. But generally what will happen as that becomes normal, it's obviously general near point convergence exercises, if you've done them, like pencil push-ups and some of the Brock string exercises, not super functional, right? You don't generally do that on a daily basis. But as that becomes normal or less symptom provoking, then translating it into a functional, maybe like functional task. So adding layers to it, making it more challenging, particularly if it's still something we feel like might be provoking some symptoms. So making it a more difficult task, essentially.
Great. Question from Lori. What are some ways to reacclimate to using a computer? Looking at a screen for extended periods of time brings on pulling behind one eye and other symptoms.
So there's a couple different levers you can pull there. So some of it depends on what exactly is provoking your symptoms. One of the common things is the blue light, so the really bright stimulating light. So there are apps you can download. One of the ones that I typically recommend is called Flux. It's f.lux. Or if you have a screen that does night vision, that tends to be less stimulating than like the full bright screen. That might allow you to do a little bit more. But then also taking your screen time and treating it like an exercise. So with therapy, the goal is to provoke symptoms that causes adaptation of the system. But if you get to the point and don't stop until you're miserable, your brain can't really accommodate to that. So working till you have like a 2, 3, 4 point change in symptoms, taking a break until you return to baseline, and then returning will get you a little bit better or a little bit more rapid improvement typically than waiting till you have to take a break to step away. it can be frustrating initially. And some people might not have that option, but if you do and you're in a situation where you can, that's going to give your body the best chance to adapt and improve your overall tolerance to screen time.
Great. A question here from Mary, which I think is a good one. You know, knowing a lot of people are trying different treatments, should PT be a consistent treatment for a specific period of time? Is there value to breaking up treatment sequences depending on individual progress for that treatment?
So again, a lot of it's situation dependent. So nature of the beast, with insurance, we're working within certain constraints. So sometimes we'll do, a lot of it's dependent on what the resources are and what that looks like. I've seen people take a long time to respond. So maybe typically what it is, again, from a reassessment perspective, looking at, are we making good progress? Are we seeing the change that we would expect to see given this individual case? If no, what can we change? Because again, you don't want to be doing the same thing over and over again and seeing no improvement. So then if we're not seeing the change that we would expect, given the amount of time and the individual situation, then pulling other levers. So it could be additional resources, additional treatments. Maybe we back off physical therapy for a time to try something else. So a lot of it depends on the level of improvement. If you're seeing really great improvement, continue. But if we're not getting where you would expect, then maybe it's time to start pulling other levers and trying some new things.
Great. We had a question earlier about cervical injections. A similar question here. How important is assessment of cervical spine alignment before starting physical therapy?
So from a alignment posture perspective, we don't typically see that posture or alignment generally correlates very well to pain. It's good to see what your resting position is, because that can give us some information about what symptoms might be provoked, and just to see where you are. And we also can utilize that to rule out any need for additional imaging maybe, or any red flags. But it's good to note, but it's not generally something that's gonna significantly shift where we go from an intervention perspective, if that makes sense. So helpful to know, can indicate a couple of different things, but it's generally posture, especially if you have the available range of motion. So if you're stuck somewhere, that's different. But if you might have not great posture, but you can move and rotate and do what you need to do without significant limitation or pain, posture is not generally super correlated to headache or a lot of the other things that you might be dealing with.
Great. Let me just say, Dr. Walston, we are breaking records for questions here, so let that be a compliment to you, and thank you everybody for the questions. You still have time for a few more?
Yeah, absolutely. That's why I want to make sure we had time for this. That's awesome.
Awesome. So one question here, how can we find a physical therapist who has specialized training in PCS? And I'll say, as you sort of think about the answer to that, certainly encourage people again to go to concussionfoundation.org/helpline, and we'll do our best to find you a specialist in your area who we know may have experience treating PCS. But Dr. Walston, you know, there aren't a million of you. What do you suggest for people?
So it's helpful to interview therapists. So if you maybe are in an area, there's different, like the Concussion Legacy Bank, there might be different resources. For me, I'm a neuro specialist, and the APTA, which is our large body, has a basically find a specialist website, and so you can type in your zip code or go there and see if there's anybody in your area, but that doesn't necessarily mean that they specialize in concussion. So calling whatever clinic you feel like is closest to you or might be a good fit, and asking to speak to the therapist, ask questions, ask what their experience is, because again, that's really crucial to getting you what you need out of therapy. You want someone that has some experience and some resources to draw upon to get you the best results.
Yeah, we have a one-pager on our concussion clinics page which is clinics.org, that's about, you know, what to ask and what to think about when you're looking for a doctor to treat your concussion. And I would guess that a lot of those same things apply with physical therapists. And like you said, it's really ask those questions. You know, don't be afraid to really their experiences.
You have all the power in this situation, so asking those questions, you don't feel afraid to press a little bit and make sure it's a good fit for you, because that, again, that's really critical that somebody has exposure and experience here to getting optimal results. So don't be afraid to ask those questions.
Yeah, that's great. Question from Ashley: does cryotherapy help brain healing?
I haven't seen the research on that. So honestly, my theory on a lot of these adjunct therapies and things that could be a resource to you, if you feel like it helps you, by all means. So again, it's going to be highly within reason, I guess. We could get into a couple weird things, but looking at, if you're open to trying different things, see how you feel afterwards, see what you feel like your response is, and then if that's something that works for you, keep doing it. It's again, highly situation dependent. What works for one person is not going to be awesome for another person. So if you find something like that that is valuable and you feel like has an impact in how you feel, then absolutely go for it.
Great. Question from Matthew: how can physical therapy assist with handling the, quote, price to pay for an activity that you know is going to aggravate your symptoms? So he says, for example, a cognitive activity that requires you to shut down or sleep following that activity. You mentioned sort of that point system. How do you approach that?
So the goal is to remove symptoms, but if we push you past a point where you feel like you have to completely shut down and you have to go take a nap, at some point the cost isn't worth the benefit. So depending on what the task is, the skill in the therapy is breaking down that task, taking it, maybe if it's too stimulating for you at the moment, taking a piece of that and then working up into whatever that task might be. So the goal is mild to moderate symptom provocation. You should be able to recover relatively quickly. It takes you a little bit longer than a couple minutes. Generally, it's a little bit too much for you at that point, because again, we want to be efficient with your time in therapy and with your exercise plans. If you're spending 10 minutes calming down from an exercise we ask you to perform, that's too long, and it's going to take you way too long to get through your exercise program. So breaking it down to it should be a little stimulating. It shouldn't feel great, but it shouldn't then cause you to have to completely shut down, take a nap, completely remove yourself from a situation. That's generally a little bit too much at that point.
Got it. Question about emotional symptoms. Is depression or anxiety a symptom that, as a physical therapist, you actively monitor as you're helping someone through treatments?
So it's a really common secondary effect of having symptoms for a really long period of time, particularly if you're one of those people that was recommended to completely remove yourself from activity. We see anxiety and depression rates skyrocket in people that are removed from their social groups, removed from their sport, removed from the activities that they enjoy. So it's absolutely something that we can monitor, and we do monitor, typically in partnership with other providers, especially if it's something that's changing and evolving. And that's also something that the research supports, that regular exercise can help kind of stabilize and assist in managing a lot of those depressive and anxiety symptoms as well.
Great. Question from Jenny. She's had PCS for a year. Therapists have tried almost everything to help with her sleep, but it doesn't seem to help. Is there anything she can do with physical therapy to help sleep?
So a lot of what you've already tried. So from a physical therapy perspective, exercise, again, just general exercise is beneficial, kind of we talked about with regular aerobic exercise, but also considering when you do the exercise. So that's different for everyone. Typically, high levels of stimulation before bed don't generally help from a sleep perspective. So considering when you do them, looking at your environment for sleep, looking at what you're doing immediately before and how your day is structured, because especially if you're less active than you were before, that can cause at baseline issues with regular, like falling asleep and staying asleep. So that can be beneficial. And then looking at general sleep hygiene things, some strategies to help, because again, after a concussion, you tend to be more sensitive to things that you might not have really been bothered by before. So really taking an audit with your physical therapist, looking through the strategies you tried and potential ways you can leverage maybe some alternative methods that might help improve your sleep quality.
Great. Here's one we haven't covered from Claudia. She said, I've been prescribed Elavil for the prevention of migraines. My concern is that it masks the symptoms, making it counterproductive to practice PT while medicated. What are your thoughts about medication for PCS and doing PT at the same time?
So I see a lot. Especially if the migraines are highly debilitating, it can be helpful to allow you to do any level of exercise, intervention, activity. So it can help remove the barrier from, I see sometimes neurologists, depending on who your provider is, obviously this isn't like medication is not something that we're gonna monitor or not change or adjust in therapy. That's a separate conversation with whoever prescribed you that medication. It can be helpful short term. Sometimes over time, I see it tapered off. So depending on what your symptoms look like, what your recovery looks like, you might stay on it. It's not necessarily going to prevent your recovery in therapy. But if you have concerns about that, I would definitely talk to your therapist and talk to the provider that prescribed that to you if your desire is to be tapered off of that.
Yeah.
Just don't stop taking it. It's like cold turkey, that's not good.
Right. We are almost at the hour here. We'll take a couple more questions for Dr. Walston. What about exercising in a pool after PCS?
Yeah, so again, a lot of it depends on what you enjoy. If that's something you like to do, that's awesome. So looking at what modes of exercise will get you doing it regularly, that can be helpful, like swimming, or could be something like water aerobics, that can be helpful too. Whatever you're going to be able to adhere to and perform regularly, because it's only beneficial typically if you're doing it. Most of the recommendations are 3 to 4 times a week, generally 30 to 40 minutes a day, working up to that if you can't tolerate it. But that's where, especially when you're looking at neuroplasticity and some of the positive impacts of aerobic exercise, that's about the dosage you need to be at. So it doesn't really matter the mode if that's something you enjoy. So it can be really beneficial for sure.
Great.
Mm-hmm.
What about supplements for recovery? Do supplements help?
I've seen, so again, I've seen a couple different things prescribed. I've seen magnesium, I've seen a lot of omega-3s. So there's good theory behind it, but there's not, so from like a supplement research perspective, there's not a ton of research to support one way or the other. Word of caution though, especially if you're on other medications, sometimes supplements can have some negative side effects or mess with whatever medications you're on. So while I see some benefit, I see people benefit from them, it's, if you're taking other medications, helpful to make sure you clear that with your physician so that there's no unexpected side effects of them, but I have seen them be helpful.
Great. All right, let me give you one last question. This one is from Jean. Is therapy possible for multiple unhealed concussion patients, for a multiple unhealed concussion patient who has lost the ability to walk or stand?
Mm-hmm. So yes, requires significant modification. So just as my background is in moderate to severe traumatic brain injury, so I'm very used to modifying to fit all people. So again, a lot of it depends on what you're dealing with from like a cognition perspective, potentially, or what other issues there might be just from the amount of time going past. But typically, yes, absolutely. A lot of it depends on what your goals are and then what type of issues you're dealing with, but yes, can be very beneficial.
Awesome.
Even if it's your 8th concussion or 50th concussion, yes.
Right. Thank you so much, Dr. Walston. We really, really appreciate both the presentation and the amazing Q&A session. Thanks everyone for your questions as well. But we really appreciate you taking the time today. Any final message for our listeners?
Questions were awesome, guys. I really appreciate that. If like maybe you didn't want to share or you want a little bit more privacy, again, I'm not kidding. Feel free to email me. I'm happy to be a resource. If you happen to be in the Atlanta area and you want a recommendation for a physical therapist that can help you, or even if you're not in the Atlanta area, the physical therapy group and network is small. So I'm happy to help if you need a recommendation or need help finding a provider. And please use me as a resource. But thank you so much for your time. I really appreciate it.
Thank you so much, Dr. Walston. All right. I will wrap us up here. So thanks again for everybody tuning in today and for Dr. Walston's amazing presentation, and thanks to Noah Bond, of course. Be sure to sign up for our next webinar in this series. So we've got 3 more coming up. Our next one is July 9th at 4 p.m. Eastern. I'll be hosting CLF Medical Director Dr. Robert Cantu for another 20 questions on concussion. You're welcome to send us any questions you have for Dr. Cantu ahead of that webinar. You can email us info@concussionfoundation.org. Then on July 16th, Dr. Len Mesner will join us for a webinar on how vision can impact concussion, or how concussion can impact your vision. And finally, on July 22nd, Dr. Tamara Wexler will present on what you need to know about neuroendocrine dysfunction after concussion. So those are all up on your screen right now, and the links to register for those webinars will be in the chat right now. Again, we want to let you guys know we are here for you and your family. If you're looking for help, if you're struggling, or if your loved one is struggling, please reach out to us at the CLF helpline. The URL is concussionfoundation.org/helpline, and one of our helpline staff members is eager to help you out. And if you found this webinar helpful and want to pay it forward, donating $20 will help us continue to create more resources for this community. You can find a donate link in the chat right now. Thank you again for joining us. Please let us know what you thought of today's webinar. I'm going to launch a poll right now, and we'd love to hear what you guys thought of Noah and Dr. Walston. That should be up on your screen now, and we really look forward to seeing you again in July for the rest of our summer series on concussion.